on directly to the next presentation, which is Professor Tahmina Shirin from the Institute of Epidemiology, Disease Control and Research in Bangladesh, and she'll be talking about the dengue situation in Bangladesh.
Respected audience, very good morning. First of all, I would like to thank the organizer for inviting me. She already told that from where I came. Actually, our institute is under Ministry of Health and Family Welfare, and we, with the responsibility for disease outbreak investigation in the country and also disease surveillance, and we have 3 tiers of field epidemiology training program that we host. So this is Bangladesh, and it's a very densely populated country. 147,000 square meter accommodates more than 175 million people. And location was it is situated in Southeast Asia, and the country is surrounded by India, Myanmar, and on one side there is Bay of Bengal. And if we look at the climatic condition of Bangladesh, it's humid and it's hot. With the average temperature is 26 degrees centigrade, and the average rainfall is 2,200 millimeter. And it seems that it's a monsoon-driven climatic condition, which actually a favorable condition for the mosquito breeding, and thus makes the country more vulnerable to the vector-borne diseases, especially the along with other vector-borne diseases. Now we are struggling with the dengue virus and other arboviruses in the country. So if we look at the vector-borne diseases, right at this moment we are having this viruses that we are having. First of all, I would like to give the emphasis on dengue virus, which was identified back in 1960s. Later on, there was a large outbreak in 2000, and since then we are having the dengue infection in all the years. And the chikungunya that we identified back in 2008, but we had a large outbreak in 2017, but this year we are having more chikungunya cases. Around 45% of the febrile patients are positive for chikungunya virus, and we have a okay, and then if you look at the Zika virus, the first detected case was in 2014, but since 2023, we are getting few Zika cases in the country, and we have a Japanese encephalitis surveillance platform which covers all over the country, and and we are having the Japanese encephalitis is 2.6% of the AES case, that is acute encephalitis cases. 2.6% are positive for Japanese encephalitis, and recently we found 7 cases of West Nile virus leveraging this JE platform, surveillance platform, where the patient were negative for the JE. We did West Nile virus, and 5 out of 300 people became positive, and we also, the Bangladesh also got the JE virus in the wild bird. So it's in our circulation. Now, if you look at the reported case since 2000, when the first outbreak happened in country, around 584,000 cases were reported. But here I would like to mention one thing: these are all the reported cases, and this case, basically most of the public hospitals and few private hospitals, they used to report. So it's not, we are not, there are some sort of limitation, but because we are not getting the cases from the community with the mild or moderate symptom, only the severe cases, when they get admitted in the hospital, we get we get these reports. And one nationwide nationally representative serosurvey was done back in 2014 and 2015, where it was estimated that the infection rate per year is around 2.4 million. And regarding the dates is since 2000, and the only here we can see 2,627 this. Again, these are the reported. And one more thing is the case fatality is a bit higher than the global scenario, but this is, the severe cases, they get admitted in the hospital, and among them, actually the death is among those severe cases. So it doesn't reflect the real case fatality in the country. So the spatial distribution showed that the cases are all over the country. And if we look at the seasonality of the infection, all over the year there are some dengue cases with the peak during July to September, and due to the climatic condition, now we can see more cases in both ends of the season. And so this is another thing that we have to look at. And around 41% of the patients who are infected, they belong to age group of 16 to 30. So here we can see the different outbreaks all over the since 2064. So after 2064, in 2000, I have already mentioned there was a large outbreak. Following that, 2019 there was another outbreak, and between 2019 and 22, we got very few cases, maybe due to the masking effect of COVID pandemic, and then 2023 there was another largest outbreak. It was the largest outbreak in the country, where more than 300,000 people were infected. Again, I would like to say these are the reported, and the death, this is also the reported. And 2024 there was a large outbreak with case fatalities around 0.57. So it's a bit higher than compared to others. So the reason behind this, one of the possibility that there are, in 2000, there was a large outbreak with 4 serotypes at that time in the circulation. And after 2003, we didn't find DEN 3 and DEN 4 in the circulation, and we have historical data since 2013. And so 2013 to 16, there was only DEN 1 and DEN 2 in the circulation with DEN 2 predominance. And then from 2017 and 18, there was re-emergence of DEN 3 in the circulations, but it was not the predominant strain at that time. However, in 2019, there was this DEN 3 became the predominant serotype in the circulation, and then we have a large outbreak in 2019. This is because we presume that this is because of the serotype switching from DEN 2 predominance to DEN 3 predominance. Again, in 2023, there was re-emergence of DEN 2. And there was a largest outbreak. So these serotype switching may be one of the key factor for this outbreak in the country. And this year we are having, again, we are observing that there is re-emergence of DEN 3 in the circulations, and we anticipate that in 2026, if it became the predominant serotype, there might be another upsurge of the cases in the country. So, and if we just think about this serotype switching, the frequency of serotype switching before, I should say till 2018, the serotype switching was not that much, but after that, there is the frequency of serotype switching much more compared to the previous year. So this is a very striking thing and important thing that might create more difficulty for handling the dengue in the country. So the spatio-temporal dynamics, if you can see the number of cases in the country. So historically, actually, the big cities, the dengue cases were more in the big cities, in like Dhaka, which is the capital of the Bangladesh, and another two big cities like Chittagong and Khulna. The cases were mostly in those places. But during 2019 outbreak, there was extensive spread of the disease all over the country because of people mobility, because it happens during Eid vacation. It's a religious vacation where people used to go to their home and they spread all over the country, and thus the disease also spread all over the country. And in 2023 outbreak, the cumulative number of cases was more outside Dhaka. And now we can see in 2025 on the right hand side you can see the cases is all over the country with some very large number of the cases. And this year we found there is an outbreak in a coastal area. This is the first time it was reported in the country. If you look at the climatic condition, if we just divide the whole period into 2 decades, from 2000 to 2010 and then 2001 to 2024, here you can see the temperature difference around 0.25% increase, 0.49% in degree centigrade increase of temperature over the period, and which also decrease the extrinsic incubation period, and that expedite the transmission of the disease in the community. And rainfall also decreased, but the pre and post monsoon rainfall increased. So it also, thus now the season become expanded. So we can see more cases at the end and at the beginning of the seasons, which was not before. And then if you look at the cases over these 2 decades, it's increased 21% times more compared to the previous decade. And the death is also more than 10 times. So this is another thing that we have to face, and we have to think of it. We need to prepare ourselves how we can overcome these uprise of the cases as well as the death. So if you look at the setup, the urban and rural setup, you can see the densely placed multi-storied building in the urban setup, and just beside the multi-storied building there is urban slum. So these are very diverse population. With if you consider their socio-demographic characteristics, their behavior, their practice, their understanding, everything is totally different. And the scenario in the rural setup is much more different compared to the urban area. So there, if we think about the breeding place is differ from the urban setup to the rural setup, as well as within the urban setup between the multi-story building and the urban slum. So we took some public health measures as a preparedness. We do the entomological survey 3 times in a year during the pre-monsoon, monsoon, and post-monsoon, and we look at the Bruto index, household and container index, and also for the Aedes mosquito or Aedes larva, and we also look at the breeding sites where the mosquito breeds. So if you look at the picture, in the multi-storied building is the main source for the breeding of the mosquito, followed by the under-constructed and other places. Our Dhaka city is divided into two city corporation. One is North and another is South City Corporation. Always we see more cases in the South City Corporation compared to North City Corporation. If you look at the urban setup, I mean, here you can see a discarded tire. When there is rainfall, the water accommodates within this tire, and it's a very common place where mosquito breeds. Another one is a plastic bucket. These are also the discarded plastic bucket, and you can see the larva on the water. And another one is that we have now the urban people, they used to build their garden on the top, I mean, on the rooftop, I mean, especially the multi-storied building. So the discarded plastic pots around the garden, these are also the source of mosquito breeding. And another thing is that when there is construction in under constructed building, they used to soak the floor with the water and keep the water for several days or even months. So this is another common place where actually mosquito breeds. And I have already told that you also already saw that the multi-storied building, the breeding place is more in the multi-storied building, and this is the basement of a multi-storied building with a very poor drainage system. So when water accumulates in the underground of the or basement of the multi-storied building, so these are the neglected area, and people don't take care of these things, so mosquito gets chance to breed. And here you see it's a very, I mean, a neglected area. When the small amount of water accommodates in the small pit on the manhole, we found the larva here. So it's very tricky place, and always people overlook those things, those places. So actually here I should say, I mean, the community awareness and community engagement is very important thing. These are the area where we can work. In future we are started working. There are some activities that are running in the country, but it's not enough to engage the community people or build their awareness. So if you look at the urban setup, the rural setup, here you can see the water is accommodated in the reservoir, and there is no lead. So here we found the larva in this open reservoir. And mosquito also breeds in the water which accommodates in tree hole. So this is for the rural setup. Another thing is that this time we found, I have already mentioned, there was an outbreak in the coastal region where the drinking water is salty. That's why people used to preserve their drinking water, but they don't put the lid on the reservoir. So the mosquito can breed here, and we also found the Aedes mosquito larva from this drinking water which they preserve in a reservoir. We also develop national guideline for dengue management. Periodically we upgrade the our management guideline, and this is I should say it's a comprehensive guideline, and it is actually helps the clinicians to manage the patient. Everything is well described in this management guideline. We also developed public health messages for the community awareness, but it's not actually enough to the thing that we want to do to control the mosquito in the community. We also arrange the training for the doctors, training and refresher trainings for the doctors and the health managers for better management of the patient and for better diagnosis, for the better detection of the cases in the community. We do the media monitoring where the journalists used to come to our place. We orient them regarding these the symptoms, and the warning symptoms, and the places where actually mosquito breeds for mass awareness, so they can transmit the information to the community through the mass media and printing media. So these are the publications from our side, and the thing is that, I mean, there are so many scopes. So there are so many scope that we can work, and so many gaps that we identified, but we have to work, and we can work together as well. I can, because everywhere there is budget constraint, or we need the funds for these activities. So if we can have the good collaboration in country and outside country, that would help us to do this activity in future. So all these things I would like to stop here. Thanks for patience hearing.
Again, we'll take questions at the end.